Well, this is another pretty tragic betrayal of another generation of families who thought that they were going to be looked after properly. What we have to do now is build a consensus for some action, and action quickly. So I think what I'll be pressing for in the next few months is a rapid move towards working out what we're going to do, because one thing we've definitely learned is if you don't make plans for this at the beginning of a parliament, you don't get round to doing it. This is not the kind of thing that gets done at the end of a parliament. We need decisions right now. It's extraordinarily disappointing that this promise has been broken, but we need to move on, and we need to get everybody together and get this sorted out really quickly, because people's lives are being ruined.
14 years ago, Sir Andrew Dilnot wrote a report about how to start fixing social care. He recommended limiting how much any one person has to pay if they fall ill and need care. The idea of a cap, one cross-party support. But in those 14 years has been put off again and again. A lifetime limit of £86,000 was finally due to come into force in October of next year. But Rachel Reeves has scrapped those plans, saying it would save her more than £1 billion. Time then to talk once again to Sir Andrew Dilnot. Good morning to you.
Good morning.
Did you see that coming?
I didn't see it coming until right at the end, although I'm not all that surprised, because it's happened 3 times before. We've now had it cancelled or at least postponed by a coalition government, a Conservative government, and now a Labour government. So it's another example of social care, this incredibly important, wonderful, powerful thing being put to one side, being treated as though it's not important, and it's a tragedy.
So for the coalition government, presumably this was to do with austerity. The Conservative government, I can't remember exactly what. All I remember is Boris Johnson saying he had an oven-ready plan for social care. Yeah. For this government, it's about, well, we've opened the books and things are pretty bad, so we've got to make savings. Those are all convincing arguments. However, many people getting in touch with us will say, when is it going to be the right time? There's always going to be something, but this is something we must fix.
Yeah, and it's also something, I think people have got a reasonable case for breach of promise. Wes Streeting, who's now the Secretary of State for Health and Social Care, in the run-up to the election said, one of the things that we've committed to is the cap on care costs. I've wanted to give the system the certainty this side of the election. So they promised they'd do it. Now, of course, we could say that's just politics, but if we can't take seriously when members of the shadow cabinet become the members of the cabinet and have made a promise, what are we to do? And as you say, of course, to govern is to choose, and nothing is free. And I've never felt that we should pretend that this is free. It does cost some money. The amounts of money involved are very small relative to other areas of public spending. So Rachel Reeves' decision will save her about £1 billion in 2025-26. In that year, public spending as a whole will be in excess of or around £1,000 billion. So 1/1000th. This is an area where working together, we can transform people's lives and move the experience of needing social care from being one of deep anxiety and distress to being one that works for people. So why would we not do that?
I'm just looking here. Rachel Reeves says that the £1.1 billion needed for this, for scrapping it, had not been provided. She feels this was, yet another example of the Conservatives saying they were going to do stuff, but actually they didn't have the money. Let's try and be positive here. What they say they are going to do, they're expected to launch a royal commission to seek a cross-party solution. Now, there's already cross-party support for the idea of a cap. Yeah. So what does that mean, do you think?
I honestly don't really know what it means. There was a royal commission in 1998. There was the commission I chaired in 2011. I rather think we've had enough commissions. I think we know what the choices are here, and so we should get on with it. So I think the thing to do is, as you say, let's be positive. Let's dust ourselves down, say, well, this is another pretty tragic betrayal of another generation of families who thought that they were going to be looked after properly. What we have to do now is build a consensus for some action, and action quickly. So I think what I'll be pressing for in the next few months is a rapid move towards working out what we're going to do, because one thing we've definitely learned is if you don't make plans for this at the beginning of a parliament, you don't get round to doing it. This is not the kind of thing that gets done at the end of a parliament. We need decisions right now. It's extraordinarily disappointing that this promise has been broken, but we need to move on, and we need to get everybody together and get this sorted out really quickly, because people's lives are being ruined.
Well, on that, just finally, Sir Andrew, we know what the savings are, £1 billion. What are the costs of not having a cap, do you think? Personal
So,
costs, financial costs?
so I think anybody who's experienced in their own extended family somebody needing care will understand this. The point at which you need care is already a very vulnerable position. But at the moment, needing care is a bit like being in a shop with no prices. So you know how much it will cost per week or month to have your partner or your mum or your dad or your granny looked after, but you don't know how many weeks or months it will go on for. So you've no idea what the cost is. I've met people who feel that they wish they would die so that they weren't a financial burden on their families. That is a terrible position to be in. On top of that, the wonderful people, mainly wonderful people who deliver this care, are very poorly paid. And part of the reason they're so very poorly paid is that nobody knows what the end situation will be. And the people in social services departments making allocation decisions face decisions that none of us would like to make. So the human cost of this is vast. And on top of that, there's a cost to the National Health Service. Social care is now under such pressure that we have significant numbers of people who are stuck in hospitals when they'd be much better looked after if they were out in the community in a social care setting. And the NHS will be much better off as well. So individuals, their families, the people providing care, their employers, and the NHS are all struggling because of the failure to tackle this one really relatively manageable problem.
And I hear your frustration, and I think people will understand it too. You talked about, many royal commissions. If you had, I don't know, 15 minutes in a room with Wes Streeting and Rachel Reeves, what do you think you would say?
I'd say what I've said to their predecessor, and indeed have said to them. This is a classic example. I'm an economist. Excuse the technicality. This is an insurance problem. Almost all of us will need social care, but most of us won't need very much. Some of us will need an enormous amount. The way we treat social care at the moment is a bit like saying, as far as your house is concerned, save up enough in case your house burns down, or save up enough in case your car crashes. This is a risk pooling problem. The private sector will never insure this risk. There's too much uncertainty. It's too long term. Only the state. This is an example of the relatively few things where only all of us working together through the state can act and help. That's what the cap is. For goodness sake, let's find a way of paying for this. This is a way of this would create a wonderful legacy, political legacy for them, and a transformation of people's lives, as well as an enormous boon to the NHS. Let's just do it.
Sir Andrew Dilnot, thank you very much for talking to us.